Welcome to This Explainer. Today, I'm stepping into the role of your senior policy advisor. We've got a critical briefing on how our digital health initiatives, specifically the Ayushman Bharat Digital Mission, are literally unlocking equitable healthcare across India. You all know the scale we operate at, right? The decisions we're making today about our health infrastructure, they're going to define this nation's economic and social stability for the next 50 years. So we're going to dig into the digital architecture that makes this massive scale manageable and, crucially, equitable. Let's ground this whole briefing in the real human stakes here. There's this powerful mandate from the Hindustan Times that perfectly captures why these policies matter. No woman should die giving birth in India in 2026. As policymakers, it's dangerously easy for us to just get lost in the macro data, the budget allocations, the rollout plans. But we have to pause and remember that behind every single data point, there is a human life. Our ultimate metric for success isn't just tech deployment. It's the preservation of life for every citizen, no matter their geography or income. That is our true North Star. So here's our roadmap for today. We'll be covering the healthcare divide, Ayushman Bharat as the equalizer, the digital architecture itself, how we're measuring impact, bridging the remaining gaps, and finally, the road ahead. Okay, let's jump right into Section 1, the healthcare divide. Historically, we all know our healthcare system has been severely bottlenecked at the top. We've been dealing with this acute shortage of specialized doctors and advanced facilities, which are concentrated almost entirely in a few urban hubs. This basically created a reality where world-class medical care exists just 50 miles away from staggering medical deprivation. For decades, rural populations have been left incredibly vulnerable, relying on under-equipped primary care centers, while specialized care was just unreachable. And the most alarming symptom of these structural challenges? Well, it's this number. An estimated 63 million people fall into poverty every single year. Why? Because a sudden illness shouldn't mean a farmer has to sell off generational land, right? It should mean a daily wage earner has to pull their kids out of school just to pay for a hospital bed. But historically, high out-of-pocket costs for basic care have forced families into total financial ruin. A health crisis literally became an inescapable financial crisis. Which brings us to Section 2, Ayushman Bharat, the equalizer. Before 2018, out-of-pocket healthcare expenditure was at a crippling 64.6%. Today, thanks to targeted policy interventions, we've driven that down to 43.4%. That 20% drop isn't just a win for a spreadsheet somewhere. It represents millions of families keeping their life savings intact. It's real, tangible economic relief that lets working-class households actually invest in education and housing, rather than hoarding emergency cash for a potential medical disaster. And this relief is largely driven by the PMJA scheme. It's the world's largest government-funded health assurance scheme, acting as a massive safety net for 62 core citizens, basically the bottom 40% of the economic pyramid. And think about the recent expansion to include seniors aged 70 and above. This is huge. It fundamentally shifts the financial burden off the youth. When a 30-year-old doesn't have to go bankrupt paying for their parents' heart surgery because of that 5 lakh rupee annual cover, we aren't just giving them healthcare. We are unlocking generational economic mobility. With over 12 core hospital admissions already authorized, the impact is absolutely undeniable. All right, moving on to Section 3, the digital health architecture. So providing universal coverage is really only half the battle. Managing it efficiently across 1 billion people, that requires a serious digital backbone. The National Digital Health Blueprint gave us a federated architecture running on 3 main pillars: the Ayushman Bharat Health Account, giving citizens a unique digital ID, standardized registries for facilities and professionals, and the Health Information Exchange. Imagine a patient in a rural clinic. They give their ABHA ID. The local doctor does an exam and securely uploads the diagnostic report to the exchange. Tomorrow, if that patient needs to travel to an urban specialist, that record travels with them, instantly and securely. No more lugging around thick physical files, no more redundant, expensive tasks, just seamless continuity of care. Rigorous implementation of this national digital health mission is actually anticipated to unlock over $200 billion in incremental economic value over the next 10 years. You might be wondering, where does a number that massive even come from? Well, it's not just from saving admin costs or reducing paper. It comes from preventing chronic illnesses earlier through better data tracking. It comes from keeping the nation's workforce healthy. And it comes from optimizing hospital bed turnovers because doctors have instant access to patient histories for much faster, more accurate diagnoses. Plus, this architecture allows us to formally bridge the gap with informal healthcare providers, or IHPs. While we naturally focus policy on formal hospital infrastructure, we have to acknowledge the reality on the ground. In heavily underserved areas, IHPs are often the crucial first point of contact. They hold the deep trust of the local community. So by equipping them with digital teleconsultation tools and integrating their workflows, we aren't replacing them. We're actually elevating them into powerful frontline triage nodes for the formal health sector, extending our reach all the way down to the absolute grassroots level.
Let's look at Section 4 now, Measuring Policy Impact.
Driven by the sheer necessity of the pandemic and enabled by proactive policies, we've seen an explosive behavioral shift. We're currently projecting a $5.5 billion telemedicine market by 2025. The pandemic forced our hand, for sure, but it fundamentally broke the cultural barrier to virtual care. Rural patients quickly realized they didn't need to endure a 3-day train ride and miss a week of wages just to have a specialist look at a basic scan. Platforms like eSanjeevani bypass geographical barriers completely, proving quality care can be delivered directly into the hands of the patient. Just look at the sheer scale of these adoption metrics. 568 million ABHA accounts created, 350 million digitized health records actively in the system, 276 million remote specialist consultations via eSanjeevani, and of course COIN, which flawlessly managed over 2 billion vaccination records. To put that into perspective, 2 billion interventions is larger than the entire populations of Europe and North America combined. We have unequivocally proven that we can deploy and sustain digital health infrastructure at a population scale unlike literally any other nation on Earth.
Okay, moving to Section 5, Bridging the Remaining Gaps.
Because despite these massive successes, the system isn't perfect yet. As policymakers, we have blind spots that need immediate intervention. Unequal digital infrastructure is our main hurdle here. While urban centers enjoy seamless broadband for advanced hospital systems, rural internet penetration is still alarmingly below 40%. Think about it. What good is a world-class, interoperable digital health record if a primary care center can't even get a basic broadband signal to open it? If we aggressively push digital health without simultaneously pushing digital infrastructure, we seriously risk widening the very healthcare divide we set out to close.
We also have a deeply ingrained public trust deficit to deal with. A heartbreaking yet way too common sight is patients and their families sleeping on the pavement outside major government hospitals all night long just to get a physical token for an appointment the next day. It strips patients of their dignity and completely erodes trust in the public health system. But here's the silver bullet. Over 85% of households in India now own at least one smartphone. The device to solve this indignity is literally already in their pockets. We just need to build the right pathways to it.
Which brings us to our final section, the road ahead. So, how do we take the foundation of the Ayushman Bharat Digital Mission and really optimize it? First, we urgently need targeted, user-friendly, local language booking apps for all government hospitals to eliminate those overnight queues entirely. Second, we have to scale AI diagnostics. Imagine a rural clinic taking a chest x-ray. Instead of waiting 3 weeks for a visiting radiologist to review it, tech like Cure.ai can screen that x-ray for TB in seconds, making up for the lack of specialized rural staff. And third, strict enforcement of the 2023 Digital Personal Data Protection Act is totally non-negotiable. As we digitize the most intimate health details of 1 billion people, public trust hinges entirely on absolute data privacy. If sensitive health data leaks, the whole digital mission loses its credibility overnight. As a comprehensive review in the International Journal for Research Trends and Innovation stated so perfectly, digital health technologies are not just tools, they are bridges that connect patients, providers, and communities. These technologies transform our ultimate mandate from a reactive system of medical treatment to a holistic ecosystem of proactive well-being. They aren't just IT projects for us to manage, they are literal life-saving bridges connecting vulnerable, forgotten communities to the care they so desperately need. I'll leave you with this final thought as we wrap up this explainer. The digital architecture is firmly in place. The massive scale of our data proves that the system actually works, but the bridges are only as good as the roads leading up to them. Moving forward, it's our relentless policy focus on last-mile broadband access, widespread digital literacy, and unbreakable data governance that will determine if true healthcare equity is finally achieved. So we've built the digital bridges. The question is, are we prepared to ensure every single citizen can cross them?